Being told by your doctor there's nothing wrong with you is often not helpful. Patients actually find this incredulous. They go in with a symptom, or in fact a collection of symptoms, and again, as we've described, luckily most of the time patient actually doesn't have a serious disease process. What they do have is a collection of what we call functional syndromes. Now, disturbance of function is quite interesting because essentially it's a collection of the body and the mind not working properly. Now, this can happen on a biomechanical level, which is to do with how the body's actually working, a muscular level, a psychological or emotional level, and often a nutritional or biochemical or what we call hormonal level. So what does an integrated osteopathic approach actually mean? Well, firstly, it means listening very carefully to the patient's story, their symptoms, and in particular the chronology of events. Patients often say, well, I don't know why it happened, but actually there's often a reason. We pay particular attention to, well, when did it happen? What was going on in their lives at the point in time? Often they think this is irrelevant, but actually it helps us understand a lot about why their body or mind was particularly vulnerable at this time. We then do an appropriate clinical examination. This is very similar to a normal medical investigation or examination. We will look at the patient from a postural perspective. We will examine their neuromusculoskeletal system. We'll check their cardiovascular system, looking at their blood pressure, their pulse. We check their respiratory system, their neurological system. And sometimes we arrange appropriate testing. We might look at x-rays or scans, ultrasound tests, and blood tests and urine tests. This basically gives us quite a detailed understanding of what's going on within the patient. And then my job really is to help explain to the patient why these collections of things that we have found is relevant to their current symptoms. And it's really only at that time that we can explain to them, well, look, I think you're going to need to do X, Y, and Z. And X, Y, and Z is essentially the treatment strategy. Now, this may include conventional medicine. I may liaise with their GP or their consultant. They may need surgery. They may need drug medication. However, very often, particularly if the patient is suffering from functional disturbance, this is very amenable to more natural approaches to medicine, such as osteopathic manipulative treatments, stress and management exercises, breathing exercises, intervention regarding dietary change, etc.
I mean, the accident that happened to me, I tell it to you as it was described to me because I can't remember any of it because it was that bad. I was 19 years old and I just finished a show jumping competition, and I was in a lineup of 3 horses and we were waiting to have our prizes presented by the judge. It was a beautiful day and I was sitting there and my friends were gesticulating at me and I couldn't understand why. To begin with, I thought they were cheering. Then I noticed that something was wrong. They were getting more and more worked up. And then suddenly my horse dropped like a stone. It had a heart attack. And I was sitting very upright with my spine straight. So I hit the ground, and it was one of those really hot summers, so the ground was really hard. And I just went straight down on my back off the horse. The horse just collapsed like a stone. I immediately went into a massive seizure. It was so bad that the ambulance had to keep stopping. The whole show had to be stopped. I was carried on a stretcher. Everyone was, apparently it was very, I'm telling you this from the viewpoint of spectators and my parents who were there, because I'd have total amnesia over the whole accident. I was in Yeovil General Hospital, as it turns out, and I was in a bed in this coma, which went on for about a month, and I must have woken up. And actually what happened is they were trying to assess how badly I was injured, because at this time I couldn't recognise people or speak or anything. Anyway, I remember this man leaning over me with a blue shirt and periwinkle blue eyes, and he was asking me if I was all right, and I looked up at him and I thought, what a nice man. And he said, "Do you know who I am?" And I said, "No, absolutely no idea." He said, "I'm your father." And that was my first recollection after the accident that I could actually remember. And they never know how quickly you're going to regain what senses and to what extent. So I got sent home and I had to learn how to talk and move and communicate with people. And I remember being very worried about meeting people for a long time afterwards because I couldn't string my words together. My back was, it was bad for a long time, but they said I'd crushed all the nerves, which is an accident that often happens to jockeys apparently. They crush all the nerves at the base of the coccyx. So there was no question of me riding at that point. And so I'm 19 there, and we jumped 2 years now, and I'm in London, and I've got my first job, but I'm walking with a limp, and my right leg is I'm always having a problem with a limp on my right, and I decided I better go and see somebody about it. I actually saw a traditional medical orthopedic type person, and they said they thought that I might need an operation to release the problem. I was very nervous about this because I'm 21. So somebody said to me, "Why don't you go and see an osteopath?" So I go to see this osteopath, and unfortunately he is not like Gerry at all. He is a person who manipulated me in a very more brutal manner, and I was covered in bruises, but I thought this is what osteopathy did because I didn't have any experience of it, and I'm quite a brave person. So I went back 3 times and was pummeled every time, and the last time the bruises were really bad, and even the osteopath said, "You know what it is," and I said, "Well, this is what happens to me on your table when you're pushing me around." And he said, "I think you need a different type of osteopathy." And I thought, I'm not sure I want to go and see another osteopath. I've had not a great time. But the limp carried on, and I'm a very keen sportswoman, and I knew I wanted to carry on riding. And actually I played hockey as well, semi-professionally then. In the end I go to see Gerry, and Gerry is this very young man in Baker Street who I do wonder whether he's going to do me any good. But I go into his office, and I remember he talked to me very quietly, and he was very, very gentle. That was the comparison between Gerry and this other man there was just no comparison. I couldn't believe, in fact I almost wondered whether Gerry was actually doing anything, because it was so gentle and so quiet, and he spent a lot of time talking to me about how I conducted my life, and he wanted to know all the details of the accident. But I walked out of Baker Street, and I remember walking down the pavement. I even remember the railings outside his practice building, and I actually put my right foot to the ground, and it felt better for the first time since the accident. I'm always amazed that people are so happy to go to the GP and to just put pills in your mouth, which are chemicals, painkillers. There's always a place for taking painkillers, but when you have a sore arm or a sore leg or a sore back, to continually take painkillers is to cure the pain, but it doesn't stop the cause. And what I learned from Gerry is you actually have to ask yourself, why is my arm hurting? Why is my ankle hurting? Why is my back? Why am I not performing in the sport as well because my legs won't move as fast as I want? You have to ask yourself why you're in this position, and that's what Gerry is really, really good at. He divines the reason for your pain, and the beauty of this is that he sorts it out. 9 times out of 10 you don't need the painkillers, but he's a realist. If he feels that he has to work with tradition, I know there are many occasions where I've seen him treat people and say, yes, you do need to take some anti-inflammatories on this occasion, I'm going to treat you, and then obviously the anti-inflammatories will cut down, and then the treatment will take over. he does what's necessary to get you right, and he's not funny about working alongside traditional medicine at all. In fact, he quite often refers people, I think. And he has with myself. I had an MRI scan of my back and my head. About 3 years ago, I broke my left leg, a bad fall from a show jumper. And I went along and had an MRI scan. And really it's because Gerry said to me, you know, I'm not working on anyone unless they've had a proper MRI scan, so that we know precisely what position is, because I don't want to upset any part of your body. So he's very good like that. And this is where I get cross with the traditional people, because they're really funny about osteopaths. You say you think you're going to go and see an osteopath, and they raise their eyebrow and they give you that look, and they say, oh well, you can go if you like, but I don't think there'll be much point. But of course I know different. Biggest skeptic that I have ever sent Gerry was my husband, Matthew. My husband is, no disrespect to his wonderful family, but he is not of the type to go to the doctor even, let alone the osteopath. And osteopathy is like telling him to go to see planet Mars. And he had a problem with his back, and it went on and on and on, and he went to see his GP, and he's a big man, my husband. He's 6'4", he's a really big sort of person, and this back went on and on and on. And I said to him probably every day, I said, look, you want to go and see Gerry, because he'll have you sorted out, and he'll know what to do, he'll know what's causing the problem. And this went on, I promise you, for 6 months, and in the end he got in such pain that he said, all right, I'll go. And he's so sceptical. He said, he'll never be able to do anything for me, I don't believe in this. And he's a lawyer, you can imagine, he's totally sceptical about it. So he goes, and he goes to see Gerry, and he comes back, and I said, well, how did you get on then? And he said, well, actually it worked. I don't know what he did, but it worked. And I'm very annoyed, and I can't tell you how sceptical Matthew is. Just amazing.
What's critical to all of this is really understanding the expectation of the patient. And what goes with that is their belief systems. If a patient comes in, for example, with a shoulder pain, and they think all they've simply done is to pull a muscle in their shoulder, I have to really decide, is that the case or is it not the case? Sometimes patients have a variety of slightly outdated belief systems. If a patient says to me, Gerry, what do you think you actually do as an osteopath? My honest answer is to say to them, sometimes I help you change your outdated belief systems. And they'll say, well, what does that actually mean? And I'll say, well, this muscle thing in your shoulder, actually, it seemed to have occurred after an argument with your husband. And we go into how stress and anxiety may cause profound changes within their nervous system. This can cause what we call upregulation within their stress patterns. Whenever the body and mind is feeling under stressed, what tends to happen is it activates your fight and flight nervous system. This activates your heart, your lungs, your liver and your muscles. Now, as an osteopath, I'll see my fair percentage of what we call musculoskeletal dysfunction, and part of that will be an underlying stress and anxiety system. So in fact, your so-called muscular pain in your shoulder may simply be a manifestation of underlying stress or anxiety. Now, there's no doubt that treating physically the muscular component of the problem will be very helpful for the patient, and in fact it'll probably be very necessary for the patient. But if I'm right and the underlying causes are more anxiety driven, it's very important to help the patient understand that. Otherwise, what will tend to happen is their symptoms will just keep on coming back.
Well, it's not every woman who wants to admit that she's 50 years old, but on the 7th of May I am 50, and I wanted to say that I ride, I compete. You'll probably see me on a horse in conjunction with this, and I'm able to do a cartwheel, and I can run, and I have no problems with my back, and the reason I'm able to say that is one word really, Gerry. He keeps my back in such a position that I can do all these things. And I think actually you're crazy if you don't go and see him. I shouldn't have said that actually, sorry. To me it's just it's obvious. I suppose most 50-year-old women probably are thinking of hanging up their riding boots. But as far as I'm concerned, I'm going to carry on till I'm 80, and I hope Gerry's going to continue to help me so that I can continue riding until I'm 80. But I think it is a testimony to his skills that I can do all these things without any worry at all.